I'm Matt from Element Society, and recently we gave young people their chance to ask their questions about the COVID vaccine to influential people in Sheffield. Here's what they had to say.
Hi, I'm Jemmanuel Gregoire. I'm 18 and today I'm with...
I'm Greg Fell, I'm Director of Public Health in Sheffield.
Hello, my name is Fahmi. I'm 16 and I've known Sophia for a while as a community leader and a youth worker.
My name is Abdul Sabur and I am a champion with the Big Brother Burn Grief organisation. Would you like to introduce yourself?
My name is Lloyd Samuels, I'm a youth coordinator. I'm a strategic lead with Sync. I'm a radio presenter and a father.
My name is Mohammed Ibrahim, and today I've got with me Martin.
Hi, I'm Martin. I'm one of the city centre councillors for Sheffield City Council for the Green Party.
So if you could tell the youth one message about the coronavirus and why they should take the vaccine, what would it be?
Two things. I won't say one. I'll say two. Sorry. Two things. One, the being vaccinated reduces transmission of the virus, and that's important because transmission of the virus, one, protects others, and there will be some older people who haven't been vaccinated. It's important we try and protect those people. And secondly, if Sheffield is opening, if we want to keep Sheffield open, we need to keep the virus circulation to an absolute minimum. So we all need to do all we can to keep virus circulation down. Vaccinations are really important tool to help us in that job. Second reason is long COVID. So the reality is that most young people, if they become infected, or many of them have, really, really mild illness. That's sadly not the case for many of their older relatives, but for young people, will tend to have a really mild illness. But a proportion of people of all ages who become vaccinated develop this cluster of things that are now known as long COVID. It's difficult to get a handle on what long COVID is, but it's definitely real, and it's not that uncommon. Somewhere between 1 and 15%, and I don't know the true number in that, develop long COVID. Very, very long-lasting, seemingly, and debilitating illness that I would wish on nobody, young or old. And vaccination seems to protect against long COVID. And obviously, if there's less circulating virus, because more of us have been vaccinated, then that also reduces the risk of long COVID. So those two reasons, I think it's important that we all get vaccinated.
Right, thank you.
Is there any advice you would give to the youth on taking the vaccine?
Yeah, I think they should take into consideration a whole bunch of things around them. So if you want to be out there, doing normal teenager stuff, go and take the vaccine because, the impact on your family is going to be quite deep if you contract it and bring it home. Consider who's in your home, who's in your immediate circle. I live with my mum, so with her not being able to take the vaccine, I have to take a lot of precautions. I flow test constantly, purely because you don't know where you're going to get it and how you're going to get it. It's the invisible kind of demon in our midst. So yeah, just be careful and be mindful of your family, understand consequences. Kind of go and have a look at the consequences, because if you don't understand how deep this can be for especially the older generation, then you won't consider it when you're taking your actions. And just be mindful of the community around you as well. We want to get rid of this together. So we all have to act in a together manner.
So I'm going to dive straight in and start asking questions related to COVID. As we know, you've had the vaccine.
Yes.
And are confident with the vaccine. What gave you that confidence?
I think because when I was working at the NHS Accident and Emergency as a support worker, I've just, heard positive reaction and how everybody was just excited to go back to the norm. So it was a lot of good energy about the vaccine over there.
Yeah. Did any of the bad news around the vaccine, like the blood clots and related deaths, kind of deter you if you had it before then or after then?
No, I'm a firm believer of whatever happens to me will happen to me with or without COVID anyway. But I was always like not believing there is a COVID. I always thought that it was a secret agenda or something of a for dark plans and world order. But then I looked at the death rates, and I just my duty of care for my mum, elderly, who lives with me. I just thought, and I saw a lot of breakouts happening at the hospital. So I thought, this is uncontrollable, and it can, I can carry something to my mum. I wasn't bothered about me being hit by the COVID. It was like, how can I be so irresponsible and not think about my vulnerable mum at home?
Yeah, expanding on that, one of the things that I researched, but it was a while back, so it might have changed by now, but it was the thing with the vaccine doesn't actually reduce the spread, but it does reduce the harm.
Yeah.
So, for instance, you said that you don't want to like spread it to people and
Yeah.
that, but it still has the spread. So,
Yeah, I mean, at the end of the day, we can't fight what we can't see, but what we could do is be vaccinated and carry on with the guidelines, which is the 2 meters and the masks and washing your hands, and But you'll see a lot of people being shielding, but they still get the COVID. How they get the COVID, I don't know. There is some certain situation that you can't avoid it, but at the same time, you want to be careful. You want to be able to meet your. If you want to go and check on your elderly parent and everything like that from the window, that's quite responsible. But like I said, we are fighting with something that we can't see.
yeah.
So we don't have no one has the answers for everything. But what we could do is say, look, let's try to put the measurements out there, travel less, mix less, and keep yourself and with the masks, and keep changing that masks and wash your hands and read about it. But please get your information from the right resource. That's what we're trying to say.
So what are like your own, you've seen all the good that the vaccination has done. It's opened up shops and let people go back to work. What's your own personal opinion on vaccinations? Because as there are positives with it, there's also negatives. And have you taken it yourself?
I would love to have taken it myself, but I've not been offered it yet. But I'm looking forward to when I get offered. And I definitely encourage everyone to take it up. Basically, we've seen that it's really effective. We've seen that like from vaccination being rolled out, cases have dropped massively from like 400 or more in Sheffield per 100,000. Rates of kind of that figure down to like 40, and that's largely due to vaccination, because we've actually like opened up since then as well. So like if the vaccination hadn't happened, we'd expect cases to be really high. So we've got like good evidence to show that it's working. And like throughout all of the testing and stuff for the vaccination, we had quite like a lot of people wanted to be involved in that because they wanted to get vaccinated against the virus. So we have good data to show that it is safe. So I think it's really important that people take the vaccination so we can kind of reduce rates, generally. And then that'll lead to us being able to kind of go back to normal more, being more in a situation like 2019, hopefully moving past the coronavirus.
A huge thank you to Sheffield City Council for funding this project, to all the young people who got involved doing the interviews and asking questions on social media, to the One Devotion for providing interview training for our young people, and of course to Safia, Martin, Greg and Lloyd for coming in and speaking to our young people.